So the case that we're going to work on today will be a situation where the patient has some smaller laterals and was interested in just kind of sprucing up their anteriors. So this is how the patient presented preoperatively. Uh, Anytime we're looking in the anterior zone, we are kind of just drawn immediately to the centrals. The centrals certainly are the centerpiece of the smile. And looking at the centrals, yes, there's a little discrepancy on the incisal edges, and that is something that I am planning to correct as well for this patient. But just kind of taking into account the whole smile, there is general wear across the anteriors, and what we're planning for the patient, we're focused on the laterals. So this patient has, and from this straight on view from the midline, we can't really see, and I apologize, I don't have those images in the kind of lateral views, but you'll see that once we get to the software. So the treatment plan for this patient is to actually make some no prep veneers for the laterals. And I want to go through this case because I think this is a great opportunity to be able to use the system. And no prep situations are a little challenging, first with case selection, and then what can the system do or not do. And so we'll kind of touch on some key considerations for no prep cases. So I want to actually just immediately show you where we ended up, and we're going to bridge the gap from pre-op to post-op. So this is the final with CAMouflage veneers on 7 and 10. And I did a little enamelplasty on the incisal edge of number 8, and we applied some composite to the worn edge of number 9. So just to kind of show you again where we were and where we ended up. So the focus today will be for the laterals. As we know, or if you don't know, camouflage comes in two translucencies, and these that I decided to use are the low translucency variety. I use the low translucency camouflage block close to 100% of the time. And at the very end, I'll show you a case where I didn't, and kind of the difference in appearance between the HT and the LT. So I used the high translucency on a case also rather recently, and I just find the low translucency appears a bit too gray. So I like the low. Did I say the low translucency? I find the high translucency, just in case, the high translucency I find appears a little bit too gray. And so I'm going to take you through this incisal view here. So that's the incisal preoperatively on the left, and I couldn't find the actual intraoral image, so that's a screenshot of the scan. And on the right-hand side is of the final. And as far as case selection for a no prep situation, the teeth you plan or are interested in maybe using for a no prep situation, ideally those teeth are going to be a little smaller. I'm looking at, if we are focused on this case 7 and 10, we're looking at the laterals being a little bit more set lingually compared to the adjacent teeth. And how much more lingual? I would want for those to be about 7/10 to a millimeter behind the facial surfaces of the adjacent teeth. If the facial of the teeth you plan to restore are even or certainly more facial, then I would hesitate calling it a no prep case. If anything, maybe you would consider doing a little bit of preparation in the areas where it's a bit too bulky. Another reason why this particular case, not just with the laterals being more lingual, but you can see there's a diastema on the distal surfaces of the laterals, between the laterals and the canines. That also gives us an opportunity to build out material. So when the tooth is smaller, when the tooth is more positioned lingually, when the tooth is shorter than the ideal where you plan to bring it, those are all good situations to consider perhaps going in a no prep situation. The limitations with no prep, however, are when you are planning no prep, teeth will have some areas to them with undercuts, and a lot of times those undercuts along the gingival margins or closer to the gingival margins can be a bit constricting, and it makes it a little more challenging to have a passive um, seat to the teeth. And so that's often why preparation is so important, right? The preparation is allowing us to create room for the final restorative material. But I thought this case was a great opportunity to go with no prep, again, for the reasons mentioned, a little more lingual, a little shorter than we want to bring the teeth to, and some spacing on the distal aspect. So one of the key things with no prep cases is once you have the margins positioned, since we don't have a definitive finish line or a margin that was prepped into the teeth, uh, the areas that you really want to make sure the margins are visible will be along these interproximal zones. I'll go through the margin marking for this case, but this is about where I will bring the margins to. You can see from this singular incisal-facial view in the software, ideally we are positioning the margins where we can visualize the margins in its entirety around the tooth. So that means when we're marking the margins, once we're done kind of setting the margins, get into a view where you believe the path of insertion or path of draw. Imagine you're the restoration, right? You're the veneer. How is it going to seat onto the tooth? And you want to be able to visualize all of the margins because that's about where the design is going to bring the restoration to. Those are going to be the endpoints for the milled restoration, and those endpoints need to come into contact with the tooth. If in this view, the margins are hidden, if they're seated into an undercut, there's going to be some challenges and most likely some sort of interference during the seating of that veneer. And this is why no prep cases are challenging. If you get into this view and determine that maybe the neck of the tooth is really narrow and there's some sort of contour to the tooth that is just creating an undercut where the margins are entirely hidden, then that may be a sign that you may just have to abort going with a no prep situation. Because if that is the case, then ideally you would have to prep away where those interferences are or where that the contours on that tooth are creating the undercut. You basically want to eliminate all of the undercuts along the contour of the tooth to give visibility or a passive fit for the restoration. I'll try to explain that in a little more detail once we get into the design and activate the insertion, which gives a little bit more clarity to where undercuts can be. So once the margins are marked, and we're just going to do a quick review here of kind of the steps before we get into the design software. Once the margins are marked, there are options as to how we can generate the design proposals. So with multiple unit anteriors, the software will default to what is called the library proposals. So the library is just the generic proposals or anatomy for whichever teeth you are working on. So with 7 and 10, we just get generic library teeth, and that's what I would suggest using for a case like this. There is Crown AI, the AI proposal, but for the current iteration of Fast Design, Crown AI is not to where I would like to see it with anteriors. So hopefully we'll get there, but you'll see using the library teeth, how we're gonna position the library teeth where we can basically fill the restorative space, get the optimal length, the optimal angulation, and ideal position of the designs, and then we can kind of morph it into position with very little work from that point. So once the library teeth are set, this is just a view of positioning the library tooth. I'm basically trying to just kind of a general rule with the study dentistry with laterals, we would want for the incisal edges to be a little bit shorter than the central and the canine. So you can see how imaginary plane going from incisal edge to incisal edge central to canine. the lateral is going to fall a little shorter than that. There's also a slight mesial inclination if we go from the gingival to incisal for most anteriors. Since we're working on 7 and 10, we have an opportunity to kind of idealize both long axis positions. So we're looking at it from straight facial. From this view, again, just making sure we're a little bit shorter than the adjacent teeth. And I'll show you once we get to design some additional views that we would want to evaluate from. Another important view is to evaluate from that incisal view. And we can see how the facial surfaces of the laterals, I have them positioned to where they just flow with the adjacent teeth. When anytime we're working on anteriors and really posteriors included, the restoration that we're working on, we would want for it to harmonize with the adjacent teeth. Anytime there's a tooth that is much larger, or the reverse, if it's much smaller than the adjacent teeth, it just kind of stands out a bit more. So you can see how the facial position of where I'm setting the library teeth, it's more or less about even with the adjacent teeth. And once we apply the library teeth, once we set the library teeth, the software will shrink the margins down to the selected margin position. And then from that point, we're going to shape the contours, making sure the contacts are where we would want them to be. And you can see a little slight change at the incisal edge. I use some of the tools like Freeform to modify those to kind of my desired incisal shape and length. Something that you'll most likely run into if you're planning no prep cases and maybe veneers in general is whenever the margin is positioned in a certain location, especially at the incisal lingual transition area, because that margin is fixed. As we evaluate the occlusion, there is a very good chance that there is going to be an interference near the margin to where you wouldn't actually be able to achieve the value of your contacts that you would normally try to shoot for. So, for example, let's just say, like in our office for CAMouflage restorations that we're planning here, we would normally set our occlusion to -200. And if we were to use the software's automatic tool for the occlusion, or to even use some of the other tools to try to reduce the heaviness of the occlusion, as you can see here, it's set on 30. You would actually get a warning from the software saying there would be an unreachable contact. So the way we manage this situation is once we finish designing, we deliver it. We don't even evaluate the contacts pre-delivery because there's a very good chance of fracturing the restoration before it's bonded in. And once we go ahead and bond the restoration in, then we'll go through our occlusal evaluation and then modify and reduce those interferences as needed. So
Hey,
that's about
Dr.
it for
Chi,
the, yes, question?
there's actually a question in the chat or in
Great.
the Q&A. If we are using ProMonitor and clear aligners to move teeth prior to a no prep veneer, would it be better to make the spaces equal mesial and distal around small laterals, or is it better to have mesial contact and place all the space distal?
That's a good question. So just to clarify again, so the question is if you were planning some aligner therapy or orthodontic therapy for the patient, like a case here, would we want to create space on both the mesial and distal? I would say yes. We have done some ortho restorative work, and I would prefer creating an equal amount of space on each side. But as you can see, as we go through this case, even though there is contact to the mesial, we can still accomplish a great result. But anytime there is limited space, so like in this case, maybe the mesial component, it's all about how are we going to hide the margins? Do we have enough depth to the preparation or depth of the tooth being more lingual to where we can hide the margin? And so in this case, we did have enough lingual space to kind of position it there, but you could imagine if that tooth were even on the facial with the adjacent teeth, then you have another issue of, I would say, more of an issue with material thickness creating more bulk than we would want. So if we were if we have the opportunity to do ortho treatment, then yes, I would try to create space on either side. And then also, for sure, making sure those teeth are set a little bit more lingual to at least hopefully prep a little less or make it more of a suitable no prep situation. Thanks for the question. Good question.
Yes. One more question. What shade
Sure.
did you use?
The shade we used was A3. So for this A3, and again, it was the low translucency block.
Thank you.
Thank you. Okay, so into the software here. Let's activate the margin tool. So with multiple units, the software is going to want the lower number tooth. And just in case you haven't worked on this before, just to be sure, on the bottom next to the patient's name, you can see the drop down. Whatever's displayed in the drop down, that's the tooth you want to mark the margin on. So you can see number 7. We're going to go to number 7 and go ahead and mark the margin. So the software does default with the autocomplete. So the autocomplete is where the software is looking for an edge, right? But we don't really have an edge here, right? Since it's no prep. So if you want to try the autocomplete, you can see usually you can at least find a place where it completes the margin. So we'll see if we can speed it up by just pre-placing it, and then we will have to modify it into position. So let's start off. I'm going to actually hide let's hide the occlusal arrows for a second. Let's focus on the margin here. So let's start off where the contact is on the mesial. So we're going to bring this margin line right through the interproximal zone. You can see there. And on the mesial side, I would prefer trying to tuck the margins as far interproximally as we can. Now, we obviously have two sides to contend with. If there is a side on a no prep or really any anterior case that I want to try to hide the margins the best, it's going to be the mesial. That's the side we're going to see more. That's the side we want those margins to be more hidden. So we're going to favor, I'm going to start on the mesial, making sure we can tuck the margin as far interproximally as we can. And we obviously would like for the margin to go along the gum line. Something that you can do for these no prep cases is to drop the margin a little bit with a smaller diameter cord, like a 000, 00, get it down into the sulcus. It'll help tuck the margin, the gingival tissue apically a little bit. You gain a little bit more visibility to the tooth structure, so you can maybe tuck the margins a bit more subgingival, and then on the rebound, it can come back. But for this case, there was no cord place. I just wanted to see what the result would be without it. So we get to see what that is. So we can see the gingival margin, just bringing the margin right up against the soft tissue. And we can see, using kind of the reflection in the software, where that soft tissue meets the tooth. And we're just going to drop the margin as close to the soft tissue as we can. So here on the facial, we can see a little bit of recession here. We're going to just bring it right up to past the recession. Again, just right up to where the soft tissue meets the tooth. Now, here on the distal, and now with a diastema and a space, this is where it gets a little bit more interesting as to where we're going to position the margin. Now, something I do want to point out is the fact that we have a little bit of an area missing on the scan. That was our bad during the scan. So optimally, these are really tough areas. So we just weren't able to create the right angulation. But I'm not too concerned with that. What we're going to do here is we're going to try and bring that margin as far interproximally as we can, avoiding the void of the scan, while also keeping in consideration the undercuts of the tooth. So I mentioned earlier about that incisal-facial view, right? So you can see from this view how some of that margin's getting hidden there, but it depends on how you're angled. Right now, if we were to set the path of insertion right in this view, you can see how that margin's hidden. But how much can we rotate to expose it? We can rotate until we basically lose visibility of the mesial margin. But again, the mesial margin is something that we don't want to hide. We need to maintain visibility in our path of insertion selection. So what I basically am saying is we don't want for this margin in this view to go too far to where, again, it's hidden from this singular incisal facial view. I'm going to finish the margin and we'll kind of come back to this and review it in a minute. So you can see how this view, margin's still visible. That's a good sign. And so we're going to go ahead and tuck the rest of this margin into the interproximal and see we're avoiding the void. And then now on the incisal, most veneers that we do, they are to also lengthen the tooth. So we want for anytime we are lengthening the tooth, we would want for the margin to be positioned closer to the lingual incisal. So you can imagine if we just kind of terminated the margin more on the facial, there's not a whole lot of lengthening that we could do, or even if we did lengthen it, it would be a really thin extension. So we still want for some tooth support to be provided for the lengthening of that restoration. Now, as you're marking the margin on a no, especially on a no prep case, something else to consider is the opposing, right? With any case, it's important, but we can always bring out the opposing, just kind of get a visual of what's going on here. You can see how we're getting really close to this interference, and we can sort of tell that with that indentation that's kind of forming, that wear facet that's forming there. Now we can stop the margin right here, but what I have seen in the past is sometimes if we maybe thin the final design too much, sometimes that can cause some distortion. So what I'm actually going to do is extend the margin a little bit more lingual, give the software a little more real estate to generate the design. We'll mill it in that way and just understand that there will likely be this interference when we go to, number one, evaluate the occlusion in the design, but also when we go to seat it, there's most likely going to be an interference, but that's okay. I would prefer for there to be an interference so that we can first generate a nice proposal. Anytime we go error more on the conservative end or these smaller restorations, there's a greater chance of distortions in the software. So I'm just kind of giving the software, again, a little more real estate to work with to generate a nice incisal portion to the design. And that interference, we're just going to go ahead and adjust it away when we go to seat the restoration. All right, so we're going to hide the opposing. We're going to just kind of terminate. Anytime I can, bring it a little bit more to that incisal lingual area. That's my preference for these no prep, or even if there is a prep, if I am, let's say we were prepping, I would always try to prep a little bit on the incisal edge to have the margin terminate right near that incisal lingual junction. Terminate in that area without overlapping the lingual too much. All right, so let's evaluate. This is pretty much where I'm going to set the margin to. And from this incisal facial view, can we see all the margins? I feel pretty good about this. If there's any area that's getting a little bit close, it's this zone right here on the distal. Let's say this was really hidden at this point. As you know, anterior teeth, there's so many varying contours to them. If that's the case, then you might want to consider moving the margin a little more facial so that you have visibility to it. If not, there's a very good chance that that margin will interfere during the seating of the veneer. So just a heads up there. So those are the risks. And even if you still can see it, even if we can still see the margin from the singular insertion axis view, because of no reduction to the tooth, because it's like a minimally, I was going to say minimally prep, but it's no prep, that area is going to be pretty tight. So if there is going to be an interference when you go to seat it, think about these really tight interproximal areas. If it doesn't seat all the way down, you may have to adjust that away on the restoration. Okay, so let's go ahead and take a look at number 10. If we're going from one unit to the next, we can go to the drop down. We're going to select number 10, and let's mark the margin on number 10. All right, so for this one, let me actually just let me turn autocomplete off and just show you a different way to mark the margin. So if autocomplete was just jumping all over the place, we're going to take more control by deactivating it. And I like to just start off on the mesial. So let's just go right down. We know we want for the margins to be tucked away into that interproximal as much as we can. And we're going to go ahead and click along the gingival margin. So we can see this zone here. And just bring it right to where the soft tissue meets the tooth. We're going to go along the facial. And this is where on the distal half, again, we don't want the margin to be too hidden. So you can see this one probably has a bit more undercut than number 7. So I'm just going to go ahead and trace the margin upward along here. And now on the incisal portion, let's just go ahead and cut across here. We're going to cut across the incisal, and we're going to meet that original bubble, the original starting point for the margin. Give that a click, and we complete our way around. So from this incisal facial view, again, we want for the margins to be in a position where we can see all of them from this single view, because the insertion for veneers in general, the insertion, ideally, we would like to have an incisal facial position. So when we go to seat it, it's kind of from this incisal facial direction. Mostly facial, because of that's where we want for the veneer to cover the entire facial. So from this view, you can see how this margin is a little bit hidden. So what we're going to need to do is just kind of tuck this or bring this forward. We're going to bring that forward just a little bit. I'm going to turn it so we can have better control. So we want to bring that a little bit more forward. You can see this bump here. That's going to create an undercut. Bring that a little bit more forward so that, again, from this single view, we can visualize the entire finish line. And we're going to leave it about right there. So we're going to hope for this design to extend all the way to that adjacent tooth. So let's bring back the occlusal and directional arrows. For anterior teeth, we want for these occlusal arrows, the occlusal arrows are basically going to define the incisal edge position of the design. Now, you don't have to spend too much time on this, just somewhere toward the incisal. On a no prep case, we basically can just go right through the incisal of the anatomical incisal of the tooth we're working on. So something like that. The facial or the labial, just straight to the facial or labial surface, and those will be good right there. And once we get to design, I'll show you how we can even adjust the proposals, even if this is slightly off. It's not that big of a deal. I'm just checking in to see if there are any questions on the margin marking.
No questions on
No
the
question.
margin.
All right, great. So let's go ahead and move forward into design. And again, the software's default for multiple anteriors is the library. And when we go to that section, we'll get to see the different options we have. But some additional options do appear if there was a pre-treatment, where you could copy the pre-treatment, of course. That's more so for cases where you had a wax up or the pre-op contours. If you did prep away in maybe an old restoration, you can get it close to that original contour. There is also a mirrored function. That's typically if you're just working off of one, well, not just one, but you're not working on the contralateral tooth. Like in this case, if we were only working on 7, we could maybe mirror the contour of 10. But since we're working on the contralateral, there is no mirrored function either. All right, so these are the initial proposals. And you can see some warnings appear, right? We've got undercut warnings, margin undercut. So let's just quickly review what these warnings are. Let me hide the restoration here. And so you see a couple flags for undercuts. The undercuts are, as you can tell, there's an undercut both on the margin and also maybe on the body, that body of the, we're just going to call it the prep, but the tooth itself. Ways that we can evaluate it is let's actually reactivate the margin. And inside of the margin page, once the designs have generated, we have access to visualize the milling and insertion direction. So actually, it's on number 10. Let's go back to 7. So let's activate 7. All right, you can see at the software's default position for the insertion direction, notice how we have some undercuts here. Now, what we want to do is we can, and most likely with any no prep or in a lot of even prep veneer cases, especially if they're minimally reduced near the margin, there's a very good chance you're going to see this sort of warning. So this is a way to kind of get ahead of it, is to be able to visualize the margins. But as you can see, if we're viewing from this insertion, those margin positions are getting dangerously close to undercuts. Now let's go ahead and take a look at number 10. Let's see what number 10 situation looks like. Number 10, just on first evaluation, we can see no matter how we're kind of moving this around, we can't get rid of all of the undercuts. What I typically will try to do, however, if there is an undercut area, I try to position them away from the most visible parts of the tooth, because if there is a need to adjust the internal area along the margin to prevent an interference during the seating, I want for that adjustment to be away from the facial. I would want it to be away from the mesial side if we can help it. And even if we had to do it in those areas, it's not the the facial is an area I would try my best to avoid having an undercut. So you can see we have most of the facial, the mesial mostly is cleared. A little bit on the distal, I can live with that. So here on number 10, I would actually leave it right where it is. There's really not a great benefit to try to eliminate those couple of spots. So number 10, we'll leave alone. Let's go back and look at number 7. Number 7's got a bit more things going on. And we can see it's basically this area along this gingival margin. It's where that recession is. So what we can try is, let's see, can we move the insertion direction a little bit more facial? And as you can tell, see how the software is locking me up right here, right? It's getting limited on the amount we can move to the facial to kind of hide that undercut. Something that you can do is, if that is the case on veneers, what we're going to do is go back to margin, the margin tool. So I just clicked on the left-hand side of the margin window. We're going to go back and look at the margin, but we're not going to change the margin. Something that we're going to do is modify the occlusal directional arrow. So earlier we had set the occlusal directional arrow at the incisal. And what that does is it generates this proposal. So I'm just bringing out the veneer proposal by clicking on veneer on the lower right. And you can see how it generated the incisal about right there, kind of pointing to where that blue arrow is. Now that the design has generated, when we're back in the margin window, what we can do is move the occlusal arrow a little more facial. So now we're tricking the software. We're telling it, let's move the occlusal this way. And what that should do, we'll see. I hope I'm not eating my words here. So we're going to go back to the insertion direction. So I clicked on insertion. When this happens, the software is going to say, hey, the designs may reset. We're going to go ahead and hit yes. That's okay. So now we're back in the insertion direction. Let's see if I can move this more to the facial. And as you can see, the answer is yes. So now I've gained a little bit more opportunity to move and modify the insertion direction to eliminate most of that facial undercut. So you can see how you can use the occlusal arrows once. So the occlusal arrow was initially set for a better proposal generation. Once the proposal is generated and we gain access to the milling and insertion direction, and we see if you see a limitation to where you can move the insertion direction, this is a trick for you, is to go back to the occlusal, modify that occlusal arrow, and you can see we're able to eliminate most of it. Now, what about that area on the distal? What to fully eliminate it, let's see if we can move this arrow a little bit more distal. Let's see what happens here. So once we go there, notice how now we're creating some undercuts on the right-hand side. And maybe we just leave it right here. This has kind of the smallest amount of undercuts shown. And even though I know I said earlier, I try to get rid of, I would try to have the undercuts on the distal side, but if they're on the distal, you can see it just kind of pops up there. And actually maybe a little bit here. I know I'm kind of jumping around, but just understand if you see a little bit of red, that is most likely the area, if there is an interference during the seating, that you may have to touch up on the inside of the veneer. Or you could try to move the margins a little bit out of the undercuts, as the software is a little bit sensitive when it's revealing the undercuts, but I wouldn't be concerned with some red. It's totally fine. We will be able to mill these out. So I'm going to leave it right here. I hope that wasn't too confusing. So this is something that you really should do if you are working on a no prep case. You mark the margin, try to get the margins positioned to where they're mostly visible. Once you generate the proposals, come into this section, evaluate the insertion direction. Let's understand, based on the software's insertion direction, where potential interferences are. If there are a lot of interferences, as you saw, look to see if you can modify the insertion direction to eliminate them. And if not, maybe you'll have to readjust the margin position. Or as you saw here, I was able to eliminate most of it by just moving the insertion direction. So there was a little bit of a tweak to the occlusal arrow, which enables us to have a bit more of this facial insertion, bypassing most of the undercuts on this tooth. I hope that comes across pretty clearly. All right, so now we're going to save these two insertion positions. So we're going to close out of the margin window. I'm going to hit the X here. It's going to save the insertion. And ideally, you're doing this once immediately after that initial design is generated. And the reason for that is because once we tweak the insertion direction, move things around, the software likely will regenerate the proposals. Okay, so now we got the margin set, we have the insertion direction set for the designs. Now let's make the designs. So let's close the context window. You can see these initial proposals. The software made them relatively small. It kind of pushed the number 10 really far back. So anytime we're working on the library designs or library proposals, we can optimize the proposals. So we're going to go to the proposal section on the upper left. So left column, first icon. And you can see in the drop down, we really only have AI proposal. And let's just see. I mentioned earlier how the AI is not where we really want to be. Let's just see what happens. You can see how the AI, and some of this is due to the fact that I moved the occlusal arrow more facial. Everyone remembers I moved number 7 more facial. So that's what happens. We told the software, hey, the incisal, we can actually turn it on right now. Hey, the incisal is that way. That's why the AI went that way. But as we see, it's more important that we move the occlusal to get a better insertion. So it's not a big deal that the design is this way. Number 10 probably would be better simply because the occlusal arrow is more incisally positioned, but you can see not great. We would have to kind of tweak that a little bit. But I would suggest that the library is going to be an easier design. So let's go to library. Let's change this to library. We're going to hit adjust and modify the starting point of each library tooth. So let's just go in order. Let's look at number 7 first. When it comes to the library adjustment, there's 3 key adjustments we're making. We're defining the size. So we want to get the size of the library tooth optimized. We want to get the angle of the library tooth optimized, and then the general position. So let's start off with the size. So you can see how it's just a little bit smaller, even if we just position it centered over number 7. Notice in all dimensions, it's much smaller. So let's make it longer. So I'm going to use the controls on the incisal here, just using the green arrow to lengthen it. And at this stage, when we lengthen or contract or make smaller, you notice how it does so on both ends. So we want for the incisal to be longer. We also want for this gingival margin to be close, if not a little bit bigger than the original or the tooth we're working on for sure. So a little bit bigger. So we lengthen it. Let's also widen the tooth. So let's widen it into contact on both sides. We're just making the perfect tooth here. Trying to get the right size, right angle. So from this facial view, we're defining the length and the width, mesial to distal width. The third thing that we can adjust is the angulation. So this is that long axis angulation. We don't want for the tooth to have this distal inclination that just looks a little funny. Most anteriors in the aesthetic arrangement are going to have a slight mesial inclination, just ever so slight. So that looks okay. So the next thing that we're going to do is let's look at it from an incisal view. From the incisal view, we're going to try and get the facial of this about even with the adjacent teeth, right? So from this incisal, we can expand to the facial. It expands to the facial and lingual. Software gets a little funny if we expand too much. Notice it's rounding a bit too much. So just kind of to a reasonable position. Generally, even with the adjacent teeth. And this is where we may need to rotate the library tooth. So using the circle, just getting the facial to kind of flow from mesial to distal, just something like that. And just confirming that it is into contact on the mesial and distal. Now, with anteriors, another really important view is to check it from a profile view, like from the side here. So these profile views are going to reveal we want for the facial of the lateral to be close to the facial profile of the central and just kind of falling in between the central and the canine. So let's just use the central primarily as a guide. So the profile view, gingival to incisal, we want for the lateral to mimic the central. Right now, if we're looking at it, the gingival portion is over contoured. The lingual is more lingual. So using the circle, we could use this one or the one on the incisal edge. We're going to angle this to where the gingival portion is more in. We're going to bring the incisal more toward the facial. Again, from this profile view, we want for it to be very similarly matched going from gingival to incisal. We can move it back, just kind of compare. We're pretty close. So something like this. So once we make that change from the angulation perspective, you can also evaluate it from this distal and just kind of check to see, does the profile of the facial match the profile of the central? So I like to look from both the distal and the mesial. And once we make that change, I just double check from a facial view, making sure it's centered on the tooth and the restorative space, making sure we have the gingival margin close to the margin of the tooth. What I mean by that is we don't want it too far away. If it's too far away, you may have to just size it up even to get it close. And so that's the position for number 7 that we're going to work with. Now let's go ahead and do the same thing on number 10. And you can see the starting point of number 10. I'm going to make this go to the facial so we can see more of it. So starting off on the facial view, let's go ahead and lengthen it. We're going to lengthen it so that the margin gets close to the true margin of where we're working. And also let's widen this mesial distally so that it closes the space a bit better. So that's the facial view. Let's go ahead and look at it from the incisal. Actually, before the incisal, I'm gonna change the order of the adjustment here. Let's look at the profile view, and we can see kind of the same situation. It's the gingivals over contour. Let's bring the incisal toward the facial, and the gingival portion, we're going to bring that in. The whole restoration looks like it's maybe a little bit too far to the buccal, so we can move that back slightly and just kind of get an idea of that profile view. Maybe we need to go a little bit more. And let's confirm on a distal view. Does that match closely? Maybe it needs to come out a little bit more. So something like that. It just has to be close. All right, so by altering the incisal position facial lingually first, now let's go back and look at the incisal view. We're going to get the facial of number 10 positioned to flow with the adjacent teeth. So right now, notice how the distal is a little bit more out. If we tuck this in, notice how the mesial is in, the distal is out. And we can use the grid here as well. Just to show you, I'm going to activate the grid. Let's notice how this distal corner of the central, and let's look at the facial position. Just use this as a guide for positioning the facial. We can rotate the library tooth so that it flows better with the adjacent teeth. So something like that. All right, since it's so far to the facial, or excuse me, lingual, let me bump out the lingual a little bit, give a little bit more bulk to the restoration. And anytime I have this sort of situation, I'm going to try to lengthen the tooth so that the library tooth has more coverage of the tooth we're working on. So it's just something we see a little bit more with these no prep cases. So let's just say this is going to be our starting point for the design. Again, getting that to fill the restorative space, a little bit of a mesial inclination, maybe this is a little bit shorter. And then we're just going to have this as our starting point. So let's go ahead and apply the library teeth. We're going to hit OK. And so now you can see, even though we had the occlusal arrows a certain way, we modified, especially on number 7, we went more facial. That only will affect the starting point of the library. So we have full control over where we want the library to begin its position. So there are some adjustments to the design we're going to make. Let's go ahead and anytime there's a good bit of design we need to do, just go ahead and get rid of the contact window. I'm not concerned with the numbers or values right now. Let's go ahead and just see what changes we have to make for the design. So what we'll do is I'm going to activate, anytime you start off with the library adjustments and you do have adjustments to make, I always recommend going to move, rotate, scale. That's the 4th icon down on the left column, because those are global positioning tools. And this has a lower risk of distorting the design. So since it started off with number 10, if there were any big changes, let's say the whole restoration was a little bit too far facial, we could then maybe use the center control, which moves the whole restoration front or back. You can see the green arrow will only move a single surface, and the circle, again, is to rotate. So you can make minor tweaks to that initial library starting point if needed. So you can fine tune the overall position with the move, rotate, scale functions. Now, I don't really have a whole lot of move, rotate, scale to do. Let me turn off the contacts again. Not sure why they popped up. Let's look at now the sculpt tool. And usually I'll follow up the move, rotate, scale, or if there's no need to make changes with move, rotate, scale, we're going to activate the freeform. So freeform is going to be the workhorse for me to make some general changes. So let's look at number 10 first. So just looking at number 10, we can see some areas that need to be adjusted. So the way that I like to design restorations is to go from incisal down. So you can see the incisal, I just checked, I'll reactivate the grid. Let's look at the incisal position next to the adjacent teeth. So something like this. I generally want for the incisal to be about where the other teeth are. So meaning not too far facial, not too far lingual. So I'm just going to evaluate whether or not that's close. And then from there, I'm going to work my way down the facial. So down the facial to see if there's any changes I'd like to make to the general contour. So you can see as I get to the middle, maybe I want to bring out the mid facial. I'll tuck that out a little bit there and work my way until I reach the gingival margin. Once we reach the gingival margin, I'm just evaluating, again, from incisal down the facial, are there general adjustments to the overall facial contour? And so that's the facial contour dialed in. Yes, the distal contact is open, probably just because of the space and the way the software was trying to contract to the margin, but that's not a big deal. We could maybe go back to move, rotate, scale. Could we just expand it this way? But notice how it's expanding just really that incisal half to get more control to close this area or maybe contour that area a bit better. That's where we may have to utilize the free form. So here I'm going to visually close the contact there. And then from where the contacts close, where this is maybe a little bit deficient, I'm just going to shape it just a little bit better to have a better contour, a better emergence profile to that design. Now, while we close the contact, I'm going to go back to an incisal view. I don't want for this area, and here from this incisal, I can see it's a little bit open. Let's just close that a bit more. I want for this distal line angle, this distal contour to not be too far buccal, which could certainly appear over contoured and out of place. So we want for the design to flow with the adjacent teeth nice and evenly. So closing the contact, and from this facial view, looking at the mesial, is there any adjustments to the mesial that we need to make? I think that looks pretty good. The only other change is to the incisal edge. So I like to have the incisal edge. Let's maybe just round this over a little bit. The initial library proposal, I think, was a little bit funny starting point. So we're going to just take that down. Now, these transitions from where the software created the library and then reaching for the margin, sometimes those transitions can be a little bit uneven. So I'm going to follow the freeform with, this is the smooth tool. I'm just going to blend some of these more uneven areas, and you can see it's more of a uniform transition. Any areas of concavity, just kind of blending it together. This library tooth has a bit more anatomy, facial anatomy. So if that doesn't really match the adjacent teeth, you can smooth that out. Right now, this distal line angle looks a little bit over contoured to me. So I'm just going to use the smooth and just kind of tuck that in a little bit, just soften the harshness of that distal line angle. Just kind of take it back a little bit.
Hey,
Okay,
Dr.
so
Shi,
that's number 10. Yes.
we do have a
Oh, I think we're
question.
coming up on time, right? Okay.
Yes.
Yes, what's the question? What you
Can you
got?
use the mirror function to mirror adjacent surfaces? For example, mirror distal of number 9 onto mesial of number 10.
We do not. So that's a good question. Could be a nice feature in the future to just kind of make it blend. That's something that we're trying to integrate first with AI to make it more harmonious with the adjacent teeth. Another request that comes up often is the mirroring. If you design one, can we mirror it onto the other tooth? Like let's say we finish number 10, could we then flip it onto 7? That's something the developers are looking into, but in short, unfortunately, not at the moment.
And then one more in the designing
Hmm.
phase. Seems that insertion direction, this was, I think you were discussing number 7. Seems that insertion direction needs to be independent from occlusal direction.
Yes.
Okay.
So they are technically they're interconnected, but they technically are independent of one another. The occlusal direction sets the general occlusal, and then from there feeds to the software where it sets the insertion to minimize the undercut. So these don't actually line up perfectly. So remember we didn't adjust the occlusal arrow on number 10. You see how they're different? So we set the occlusal arrow from the margin step, and then the software moved the insertion more facial to minimize the undercut. So that change wasn't done by us. So technically, you can see they are independent of one another, but they are related. So the software generated this position from saying, okay, the occlusal or incisal is around here. Let's then minimize the undercuts. So we still have freedom to move this as we wish, but be careful with moving it too much after you've gone through a lot of your design, because that could affect the design. It could reset it or regenerate the proposal, and then you got to redo the design. So uh, as you can see, they are independent of one another, but still related enough. Any other questions?
Not related to design. So we
Okay.
can address later.
All right. I'm going to try and go a little faster. I'm sorry. I want to respect your time. I know we're only really scheduled to go to 1 Pacific. I'm in Florida right now. It's almost 4 in the afternoon Eastern time. So I'll try to go a little quicker here. So let's go back to freeform. We kind of finished most of the design on 10. Let's close the contact here on the distal. We're going to kind of squeeze that over. And I mentioned how I like to go from incisal. So looking at the incisal, does it line up with the incisal edges of the adjacent teeth? That's usually what I'm looking for. Do I need to tuck this a little more lingual? And then I work my way down the facial. So looking at the incisal third, I can see, is there a need to modify the contour from mesial to distal? As we continue on, exposing more of the mid-facial, maybe this mesial side is a little over contour. We can move that back. As we go a little farther down, is the distal half a little bit under contour? We can take that down. But I think the general facial is pretty good. If anything, I'll use the smooth and just kind of blend that facial a bit better. So we're going to use smooth, just kind of go along and just kind of blend in any bumpy, uneven areas along the facial. And then I like to also just double check with the profile views, making sure that flows with the adjacent teeth. There's nothing that really stands out as being over contoured, under contoured. Now from this straight facial, let's look at the incisal edge. I mentioned how I generally would want for the incisal edge of the laterals to be a little shorter than the adjacent teeth. There will be a little enamelplasty done to number 8, but this is about where I'm going to leave the incisal edge length. If anything, I'm just going to modify, just to show you here, I'm going to line up the incisal edge here. And I just don't like the way the library tooth has this little, how it zips up here. So I'm going to take this down. So I'm reducing the size of freeform a little bit and just kind of shape that down just a little more, just to give a little more full incisal edge. And this is a male that we're working on. Just because it's a male doesn't mean we got to make the incisal edge perfectly flat. Just kind of depends. So just a little shape to it, a little character to that incisal edge. But I just didn't like the way it was just pointed. So I'm going to leave it there. Once I adjust the incisal edges independently from one another, I always like to just get the midline lined up along a vertical line here. And then let's just see, how do the incisal edges match with one another? Because we do want them to be pretty close in length. A little asymmetry is okay, so we can kind of shorten this a little bit, maybe lengthen number 10 slightly. We are going to lengthen. I'm just balancing out this unevenness on the central. So we're going to shorten number 8, lengthen number 9. As long as 10 is not longer than 9, we should be okay. So just kind of getting balance between the laterals. All right, so once the general design, there's probably a little bit more that we could do, but let's go ahead, and I know because of time, we're going to go ahead and look at our contacts. For anterior contacts, I will recommend not using the fixed contacts for proximal contact adjustment. Let me just quickly show you. These are the values I want for my CAMouflage restoration to possess. So 30 on the distal, 30 on the mesial, minus 200 on the occlusal, if there's room. So just to show you, let me hit fixed contacts. This is often what can happen if you use the software's automatic function. It often will distort and screw up the contours of the anterior. So we're going to go ahead and undo. If you ever try it and it messes it up, hit undo. Now, notice the contacts are heavy. All we have to do is polish away material on the contact to lighten it. So I use smooth. So I'm using the smooth tool. Let's just give the distal a couple clicks here. Just really quick, we can get to what we want on the mesial. 110. We can smooth this down to 30. And this is how we can concentrate the adjustment just where it's heavy and not distort the contours of our design. So let's go and look at this side, the distal. I was able to get right on with the freeform earlier. Let's smooth away the mesial. And that's it. Now, what about the incisal? So what we're going to do is where I will utilize the fixed contacts or the automatic refinement for will be for the occlusion. And whenever we hit fixed contacts to adjust the occlusion, it's also going to fill in any areas that are too thin. So how do we get the software to adjust only the occlusion? We're going to deactivate the mesial and distal. So on the contacts window, we're going to hit mesial, the tooth under mesial, so that turns it off. Notice how the number goes away. And we're going to remove the distal. Notice the number goes away. And so only the occlusal is active. So when we hit fixed contacts, notice the software is only going to bulk out where it's thin, and also it's going to try to adjust the occlusion. Let me just hit that one more time. Yeah. The reason why this exists is because it's getting thin. So that this is what I meant earlier by due to the fixed location and position of the margin, the software is always going to prioritize material thickness. We could bypass it a little bit just to show you. I'm going to use smooth and just smooth out. Since I am going to adjust this down, and I really don't care that it's a little bit thin, it's not a problem. So we can smooth, just to show you the software does allow for violation of the material thickness, but know that it is at your own risk. There is a point, I'm okay doing it on the incisal because I probably will need to adjust away that extension on the lingual. And I can smooth a lot of times on these no prep cases, even when I hit the fixed contacts and the software bulks out the material, I'm going to turn on material thickness here or minimal thickness just to show you. As I smooth along the margin, I did actually mill it with a little bit of red along that gingival margin just because I didn't want the veneer to appear too over contoured. Just know that the red is indicating we are under 0.5 millimeter of material thickness right through there. Let's do the same thing on number 10. On number 10, let's turn off mesial, let's turn off distal. We're going to leave the occlusion on. And with the minimal thickness visible, you'll see how the software is going to fill that in. But it does so in a way that's more uniform. As it does that, depending on where the minimal thickness is located, it could make a contact too heavy. So as you can see here, it did actually make that heavy, even though we adjusted that down to 30. So you can do that first, double check the contacts. And what I will do is I'm willing to sacrifice a little material thickness interproximally because let me just find one less area that we'll have to adjust down. I'm just going to take that down to 30. And so this corner here will negotiate that. We're probably going to have to adjust it. You can see it is really close, interfering with the opposing. That's an area we're probably going to zip away. Now, why did I position the margin there? Again, it was to try to generate a better proposal on this incisal half of the design. So that's the design component. Let's go back to, let's take a look at the, I know we're going over time, I apologize, but I just want to complete the case for you. So I won't go through the whole adjustment, but just to show you, this is, we're doing a direct, this is after a little enamelplasty on 8. I'm doing bonding and composite on the incisal edge of number 9. I'm just going to go a little quickly through this. Now, these are the restorations out of the mill. I know they show D2, but we ended up delivering A3 for the patient. Taking off the sprues with a fine grit diamond burr. Once we finish off the sprue and getting it even with the facial surface, I'm using the Bruxer polishing wheels. So the Bruxer kit has 2 polishing discs. I used the brown pre-polish followed by the blue. And this is during the initial seating. So notice during the seating, number 7 looks okay, but number 10, notice how there's a lot more visible tooth structure. And that is an interference along the margin. Where is the interference? The interference is actually happening from where I overlap the incisal. So you can see how it actually milled with a thin, really thin spot. I didn't use the software's auto contact. I showed it in the adjustment earlier, but as you saw, I actually milled with that area really thin because I knew I was going to have to adjust it away. You can see how that goes down a little bit more, maybe a little bit of a slight interference as well. You can use fit checker, but here I'm just having to take the same fine grit diamond burr I used to remove the sprue and carefully adjust along those zones where there's a bit more interference. So you can see I'm using the facial margin as a guide to whether or not this is fully seated. So I can see a little bit of interference at the contact now, using the articulating paper to mark where the contact is, just kind of relieving it. And so in the end, the goal is to remove interferences to where that facial margin is down to where it is, or excuse me, to where it should be. Number 7 had a bit more passive seat. No adjustments needed, but again, it's just kind of it just kind of depends where that margin position is. So once we're ready to deliver, we've confirmed a passive fit. The contacts are dialed in to treat these restorations for delivery or for bonding. You saw we're going to air abrade. Something that you can try is that if you're not sure about the air abrasion, you can mark the inside with a marker and then blast all of that away, because with the, that way you know you've effectively air abraded the entire intaglio surface. Then we're using Scotch-Bond Universal. You want a good adhesive applied to the restorations, and that's going to, I like a universal bonding agent. There is silane as well, which can chemically bond to the ceramic components of the CAMouflage restorations. On the teeth themselves, we pumice and clean just to have a nice pristine surface. And really make sure, if you are going to pumice, make sure you clean all of that off. So here we're total etching. I total etch, plenty of enamel on the facial surfaces. We're going to nicely etch too. And then we're going to, we're using Scotch-Bond Universal in our practice. We're going to scrub that in really well, making sure that gets infused into all of that etched surface. And that's how we're going to create that bonded hybrid layer. You can see we're using a high-speed, smaller surgical suction, and we're going to blow off the excess. And we do cure in our practice, but really making sure that film thickness is really thinned out. And then now we use an aesthetic resin cement. This in particular is a Kerr NX3. It's their light cured variety. With anteriors, I'm always using a light cured resin. If not a light cured resin, sometimes I'll use flowable composite. Just kind of depends on the situation. But this is Kerr NX3. And with it being light cured, you have a lot more working time, technically unlimited unless light gets onto the cement. We're just using some micro brushes just to carefully remove the excess. And here I like to use, I'm just going to pause for a second. I'm positioning, and I do this with all my veneers. I have a bite stick on the gingival portion, providing lingual pressure. I have a bite stick on the incisal edge, providing a little bit of lingual and apical pressure just to make sure these are fully seated. As I'm holding it down, our assistants are going to then take a small light curing tip, it's 2 by 2 millimeters, and fully cure the center of each veneer. And so once we fully cure the middle, it stabilizes the veneer, making sure it's aimed right into the tooth. And then the excess can be wiped away. You can then take a bigger light and tack cure the excess. So that's normally what we'll do. On the lingual side, just because there may be more of a need to have sealed margins, since we've made a lot of adjustments there, I just clean off and really just close that area off. And what isn't shown is using a bigger light just to quickly tack cure. And then we go through and remove the gel cement along the rest of the margins and try to get rid of as much of the excess as we can. And so that's the cleanup. And once it's bonded in, after it was bonded in, I just saw some areas that I thought were a little bit over contoured still. So using the fine grit diamond, I kind of lowered the speed down for a bit more control. Here I'm just showing adding in some anatomy, so developmental depressions, just kind of creating the mesial and distal developmental depressions, trying to maintain, as we can see, there's pretty good developmental depressions on the central. So just kind of getting the laterals to match a bit more. I'm going at a low speed, so definitely go at a low speed because you can really eat away at the material aggressively. And I just taper up from incisal, so having the developmental depressions be a little bit wider at the incisal portion and just fade into the body as we go from incisal to gingival. I don't like the developmental depressions to be too aggressive or too defined. So here I'm using a little bit of a larger fine grit diamond burr for that. After the adjustments, now I'm using this is a Venus super polisher. So this is just a composite polisher. I like the cone shape of the Venus super just to follow the developmental depressions. And then I follow it up with the, as you see, again, that is the Bruxer polishing kits polishing disc. And so I did add a little bit of composite to the incisal edges of the canines as well, that I won't spend too much time on. But that is the, let's actually go back. So that is the delivery of the CAMouflage restorations. Just to review the bonding protocol. So on the restorations, we air braid with 50 micron aluminum oxide. We rinse and dry the restorations really well. And then we apply our universal bonding agent. In this case, we use Scotch Bond Universal and really thin that out. Here I have listed the Bruxer cement. You could use the Bruxer cement, but in anterior cases, I would recommend every time using a light cured cement on these monolithic restorations. The only time light cured would not be recommended would be not for chairside, but maybe like a PFM where there's no light penetration through it. On the tooth, we do etch. I say optional simply because depending on your bond system, you might have a self-etching primer. And for this case, you can also desensitize, of course, a little bit more necessary if you've prepared the tooth, and then followed by your adhesive layer. So again, this is where we started. That's where we ended up. CAMouflage A3, low translucency on the laterals. The composite that we use, we actually use flowable composite from 3M to Filtech A3 on the edge of number 9, and a little enamelplasty on number 8. So this is the incisal view. We can see a little bit of the formation of the developmental depressions, but the end goal for me is to try to get the facial to flow with the adjacent teeth. You know, if the contour of these was much more facial, then, you know, then of course the starting point is the most important, making sure the starting point is not beyond the facials of the adjacent teeth. Otherwise, you're better off prepping a little bit of that away to make room for these restorations. Again, the minimal thickness on the software forms at 0.5 millimeter, but that's from the start of the cement gap. So the cement gap on the axial surfaces of the software, on the axial surfaces, I want to say it's set to 120 microns. So if that is a true 120 microns, or a tenth of a millimeter, we'll call it, you're going to want for the facial surface to be lingual to the adjacent teeth by about 6 to 7 tenths of a millimeter lingual to the adjacent teeth. But 1 millimeter is a really good, sound, safe position to kind of use as a point of reference. I mentioned how, let's see, this is a case where I use the HT, so you can see what the high translucency looks like. It does look a bit more gray. This patient had some bonding done by another dentist, and we did do a little bit of soft tissue contouring. So we use our laser just to make a little more length, or provide a little bit more length. Minimal preparation here. And you can see how the HT, I think, appears just a little bit too gray. And this is a frontal view of that case. It's close, it's really close, but I would suggest in most cases, the LT is going to serve as a better option in most cases. All right, I'm going to check back in. I apologize for going a little bit over time. I think there's just a little bit, a lot to cover. in this session, but just checking in to see if there are any questions I can help answer.
Yeah, there is a question. When your margin is so facial, do you fill in the lingual aspect with composite after cementation so that there is a smooth lingual surface?
A good question. So with the linguals maybe being open, do we fill that in with composite? I normally will, you saw how I use the micro brush to kind of polish off and smooth out the excess composite or cement. I typically just rely on that. In some rare cases, if I maybe created a void during the cement removal, then yeah, we'll fill that in with some flowable to make it smooth. But that is an important point. For all of our veneer cases, I will either make sure we have to add to fill in voids, or I'll just take a fine grit diamond burr, either the round ended one that you saw earlier to take the screw off, or most likely like a football shape, and just at a low speed, just pass it over the margins, because we do want, for any veneer, no prep or prep veneer, even with prep veneers, that transition, the patient can very easily, since the position of the margin is, oh, there's a nice pull. Since the position of the margin is super gingival by a lot, we want for those transitions to be nice and smooth. Otherwise, the patient, and that is usually something I have my patients check. I'll ask them once we've adjusted most of the occlusion down, and I've already even made a pass over those margins just to make sure I even out the transition. I'll always ask them to run their tongue along the lingual. Does it feel smooth? A lot of times it's not smooth because of some lingering cement that's so hard to see. But it gives us a chance to make sure the patient is comfortable. Good question. Thank you.
And the last question here, this was from earlier. I find the bleach shade is too white and needs something between B1 and bleach.
Yes, yes. Thank you for that. Thanks for bringing it up. I've also made that request to the team. Would love for us to have, I feel like we can put like 3 or 4 shades in between the bleach and the B1. Unfortunately, it's such a large divide. So um, it's now on record and additional record. So we'll certainly make that request, and I think there's a tremendous opportunity to have um, some more shades for it. So stay tuned. Hopefully, we'll get that in soon. Thanks for that.
Perfect.
Any more questions? I see. Nope, that's you.
Is there a guide for camouflage?
Is there a guide for camouflage?
Mhm.
Like a shade guide? What do we mean by guide? Just
Not sure, Dr. Robert Wing. Are you referring to a shade guide or shade guide? Yes.
okay, so
Shade guide.
shade guide, I would say out of all the materials, camouflage matches the Vita Classic shade guide the best. So these were formulated, the formulations of the colors were very, very close. Out of all the materials, and maybe biotemps included in that, camouflage is going to match the closest. All other materials, I would say camouflage and biotemp close to the top, obsidian, the next one, and I'm talking about without any additional stains applied to it. Then the Bruxer aesthetic is going to be a little bit better. But the Bruxer aesthetic and Bruxer Now, we are very much aware of those materials being higher in value. So they're brighter, they're lighter. We would recommend going up a shade, and sometimes that's not even enough. But we are very understanding of a need for reformulation, and that is something that we are working on this year. I saw some of the samples of the reformulations, and they're much, much closer. So we are working on eliminating that as a pain point. But to your question about shade guide for camouflage, there is not one. But out of all the materials, that's probably one that we don't really need one for. Thanks for the question.
Yeah, thank you.
And yep, if there are no more questions, I just want to take the opportunity again to thank you for your time. And if there's anything else that, if you have questions on, feel free to reach out.
Thanks for joining, everybody, and we'll see you in the next office hours.